Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost reproductive health services to women in the Seattle area, regardless of income or insurance status. 3W does not profit off of the reproductive health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Helen Nguyen, CEO and co-founder of 3W Medical for Women and the host of today's podcast. Hi, everyone. Thank you so much again for joining us on our Wellness Wednesday podcast. If you don't know about us, we've been recording these podcasts since April. And we're so excited today to have Marisol with us. She's our guest speaker today. And Marisol joined our team officially as a paid staff January, right, Marisol?
Yes, okay. January.
Yeah. And when was it? Well, Marisol initially came on as an intern last year.
In August. So I started towards the end of August, but I got settled in towards September.
Yeah. Awesome. And we officially brought Marisol on to a more permanent staff position, and she has taken on the role of our Hispanic Community Advocate position. And it's been such a huge help for me, for the organization, because we're just being more and more intentional in reaching out to the Hispanic community and making sure that they know we're here for them. And Marisol speaks Spanish fluently, which is beautiful and wonderful. I've been listening to her speak. I don't know half of it or 90% of it, but it sounds great. So we're just having Marisol on today and talking about her role, talking about what she's doing here at 3W. I think you'd all be really interested and proud that we're reaching out to a much needed demographic and community to let them know that we're available to them. So Marisol, can you tell us a little bit more about yourself?
Yeah, so I was basically born and raised in the Pacific Northwest. I've been here for a really long time. But I did live 2 years with my grandparents in Mexico, actually. I think I was around 3, and I came to the States when I was around maybe like 6. So a little bit over 2 years, and that's really where I was able to pick up a lot of Spanish and read it, because I did do I think it was preschool, something like that in Mexico. And so I was able to truly learn the language and also appreciate, all our traditions and just more of the culture, because I got to experience it. So that was really neat.
That's awesome. And what are you doing now? You're almost finished with school, correct?
Yeah. So I'm about to be finished in the spring. So I can see the light. And yeah, I'm a student at UW and I'm a first generation. So go Dogs.
Yeah, that's awesome. And, we're just really excited for Marisol to step into this role. Right now, she's with us part-time because she still needs to finish school, which is rightly so. But soon she'll, God willing, she'll come on more permanently. So Marisol, why were you interested in 3W and interning with us and getting involved with us? And then how did you see your position here evolve into this position that you have now as the Hispanic Community Advocate?
Yeah, so I think when I moved to campus, I actually came to 3W for an appointment. I think I was a sophomore or freshman. It was my first time really away from home.
Sure.
And, I was just having some menstrual issues, and I was like, well, my mom's not here. She's not going to schedule an appointment for me. And it was kind of scary. It's the first time you're really out there on your own and you have all these questions and, usually your parents are with you and they're the ones talking to the doctor. And then I came to 3W and I really liked that experience. I felt welcome. I felt heard. And, the nurse was great. She went over everything with me in really good detail. And I just walked out and I was like, whoa, that was really good. And she was so patient. And so that's how I was introduced to 3W, which really is the best way. And then I thought about the internship. I knew I needed to intern, and then it was a good fit. I wanted to work with the nonprofits post-college, and here I am. But yeah, it was a good fit. All the values, the mission. Yeah.
Awesome. And you're a public health major, correct?
Poli-sci.
Oh, poli-sci.
Yes.
Well, it's
poli-sci. Yes, poli-sci with a nutrition minor.
Okay.
So it's right, it's like all the policy aspect of it, but also the health that I mean, on my own, I really like to take care of, myself, my nutrition and stuff like that. I'm a runner, so all of that stuff is right up my alley.
Right. So she's been such a seamless fit for our team. So really glad she's here. And so what made you or had you gravitate towards this role that you're in now for us? What was some of the leading factors?
Yeah. Well, during my internship, I did a research paper, and you have to do a paper for all your internships at UW. And so I started, as a first generation, I already knew all the problems that exist within health and the Hispanic community. Unfortunately, all the barriers, both financial and also just a language. But as I started digging a lot more, I realized Hispanics are 16% of the population in the U.S., and that was in the last census. So it's expected to grow up to almost 20%.
Wow.
With the results of the 2020 census. And just in King County, Hispanics are 10% of the population. And actually, Spanish is the top language spoken that is non-English. And so that already tells you so much. Like, Hispanics are here, Hispanics are present, and we definitely need to serve their needs completely.
Right.
And so as I did that research, I started learning more of like how big our presence is. And also just, unfortunately, that also means that Hispanics are 44% of the uninsured population. And so you start to see all these gaps. And I just started to think, okay, how can 3W help in that? And, eventually I ended up in this role. So
it just really fit perfectly with the concerns that you have for your community and their accessibility to get the resources they need to continue to stay healthy, and things like the inability to obtain insurance or afford insurance or access to people who speak their language are all major big barriers for the Hispanic community to emphasize or put first health, right? And especially reproductive health. So that's so important. And we're so glad that you're fluent in Spanish, you understand your community well, and that you're able to pull them into what we have to offer here at 3W. So Marisol is not the only Spanish-speaking staff we have. We also have Annabelle, who's our medical assistant who speaks Spanish as well as Alejandra, who's on our marketing team, but she's been such a huge help in filling in sometimes and interpreting whenever we have a Spanish speaking only patient. So it's been fantastic. In fact, for our listeners, we noticed that specifically in the last 6 months of last year, we were serving a huge Hispanic population of patients coming in. In fact, in November, 48% of our patient population identified as Hispanic. So it's been such a wonderful experience to engage in the conversation of health with our community, as well as bringing on staff to meet the needs of our patients, which is so important. So Marisol, can we touch base on some of the barriers that you feel that the Hispanic community has to access to healthcare? You mentioned insurance. What other barriers do you see?
Yeah, definitely language. Unfortunately, a lot of the people there, they might speak some English, but it's not as good. And when it comes to medical terms, there's such a difference. Like even I sometimes I'm like, what does this, how do you say this?
Yes.
I either know it in Spanish and I don't know how to say it in English. And I've, I basically grew up here. So it's like, so that is a huge one. But I also think there's a lot of cultural barriers because, there's some stuff that you're just uncomfortable to speak on. Or maybe, I've noticed, in the U.S. we're so open about a lot of things. A lot of, menstrual periods, pap smears, all of that is just common.
Yes.
And at least in Hispanics, that stuff is a lot more reserved.
Right.
A lot of kept to yourself. And even sometimes there can be some sort of shame when going to your doctor because, it's just you are scared to ask certain questions. And that's just the way that it is culturally. We keep a lot of things private. And I feel like a lot of the times that privacy and like lack of knowledge can really hinder you from the care that you need, especially if you just live scared to ask questions.
Right. Or even know, like, is this an appropriate question? It's intimidating across all cultures to go to the doctors, right? And then when you don't have the ability to pay, or when you have a language barrier, or even navigating the healthcare system, it's even more daunting, especially for folks that don't know the language very well. So I know personally with my background in my community, which is the Vietnamese community, which is not as huge as a community as the Hispanic community, it's even tougher. So that's very unfortunate that even as advanced as medicine is, we still have certain barriers that prevent people from coming in to getting the healthcare they need. Yeah. Anything else that you see that is lacking in how medical facilities such as ours can better engage with the Hispanic community? What are some healthcare topics that you would like for the Hispanic community to know about specifically?
Yes. Definitely what I have noticed through my research and just at 3W, just cancer. It's a huge problem in the community, specifically for women, cervical cancer. And it's, preventable. Like you need your checks up. And it's really sad that this is like one of the major problems for the Hispanic women. STDs, definitely. The rates have just skyrocketed in King County in the last year due to COVID in part, but also just in general. And specifically in the Hispanic community with things like gonorrhea and chlamydia going up more than like 80%.
Wow. Those are big numbers.
Yes.
Yes. Yeah. So what are you hoping to provide for the Hispanic community now that you understand some of the barriers, some of the needs, some of the shortcomings of the medical world in general? What is your goal for your role, and what are you hoping to achieve?
Yeah, definitely. One of my biggest goals was just seeing a familiar face, seeing someone that you can relate to, that you can identify with, that you'll just be like, oh, that person, they're going to understand me. But also just bridging that gap in language between our clinic and the community. And the clinic already bridges the financial gap, being low cost. And and I feel like a lot of the times the system can fail those on Medicaid or Medicare, or just, those that tend to be low income. A lot of the times they can just slip through the cracks, unfortunately. And I want people to come in and experience quality healthcare without having to worry of their language or of the cost.
Right. Well, what are some organizations that you've already reached out to and that you're hoping to reach out to?
Yeah. So we actually just presented over at Leti online, of course. And that was great, getting to see so many women and getting, we had a couple calls right after the presentation, which was really, really cool.
Very cool. Yeah.
Yes. That was so great to just see them. And we had cameras on and everything, and that's rare in a Zoom call. So that was, and just saying, hey, here are the resources. Like, don't let language be a barrier because, we have Spanish speaking staff. Don't let price be a barrier. And just actually seeing the fruits of that in all the calls that came in. So that was great. We're also hoping to work with El Instituto de la Raza. And they're a great organization, and they definitely are all throughout Seattle. So that would be great.
So for our listeners out there, if you have any connections with an organization that specifically are reaching out to provide services or resources to the Hispanic community, please get in touch with us, because we would love for Marisol to reach out,
Yes.
to partner, to make available and accessible the resources that 3W has to provide. You can visit our website at 3wmedical.org. You'll see Marisol on there. You'll see her email on there. You will have our number. Please reach out to us. It's exceedingly important and always way more effective when it's someone that this organization knows that can connect and network on our behalf, or connect us with the folks that are in leadership or influential in the organizations that are out there. So please reach out to Marisol. Any other organizations that you're hoping to get in touch with? Hopefully one of our listeners is connected with them.
Yeah, so I have been in a bit of contact with Seattle Latina, also Casa Latina, Consejo.
Consejo.
Yeah, so if you know any of those or any other organizations, just forward them to us.
Yes, please. And if you have any input on the Hispanic community in other areas outside of Seattle that you think would be really beneficial for us to reach out to, there's really nowhere that we wouldn't travel to. So, if there's some place in Renton, Kent, Auburn, Sumner, we're willing to travel to Tacoma if you'd like us to. I know it sounds like another world from Seattle, but please let us know, because we want to serve as many people as possible, even though it's not a Seattle-based, zip code or something like that. We serve people from Alaska. So really, we're willing and able to come to you and provide information. We can bring brochures. And like Marisol says, she's more than happy to jump on a call or a Zoom call to talk more about 3W and what we can do. So, well, thank you so much, Marisol, for joining our team. And
so much for having me.
Yeah. And thank you for doing what you do. It's such a much needed position and much needed resource. And those of you that are listening out there, please pass this resource on to those in your community that might be needing some of our services, specifically, women exams that can screen for cervical cancer, and just your yearly woman checkup. It's always great to encourage and emphasize that not only our mental health should be healthy, our physical health should be healthy. So thank you so much again for joining us on this Wednesday podcast. Tune in again next time. I'm sure it's going to be a lively topic. So thank you so much. For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more information about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you like this episode, please share it with others and consider subscribing on your favorite podcast platform so you never miss an episode. Thank you so much for listening. And until next time, stay healthy and be well.